All right, so side effects of radiation, there are a lot, and this is gonna be kind of a long video. I'm gonna start out with general information that's gonna be useful for a lot of people, and then I'm gonna divide it up body part by body part. So if you're looking for a specific region of the body, you can go ahead and check the description down below, and we'll have timestamps for the different regions of the body. Hi, I am Dr. Florence Wright. I am a board-certified radiation oncologist. If you or someone you know has recently been diagnosed with cancer and you're scared or you don't know where to start, then I'm your girl. And while I am a doctor, I am not your doctor. So nothing that I'm gonna say here is to be construed as medical advice. If you need medical advice, you have to talk to your doctor. And if you don't feel comfortable talking to your doctor, you need to find a new doctor. So side effects of radiation therapy. The first thing to know is that you are not going to definitely get any of these. So what I want you to use this information for is not to terrify you, but to have good questions to ask your doctor when you get there. What kind of side effects you can expect. These are some side effects that some crazy doctor online was talking about. Can I expect any of that sort of stuff? So we generally divide side effects into early side effects and late side effects. Early side effects are the sort of things that you're going to experience during the course of your radiation treatment. Late side effects are things that can happen either after you finish treatment or that can persist for a while after you're done with treatment, or even be lifelong side effects. So I'm gonna go through the body basically from top to bottom and divide it up into different sections and talk a little bit about early versus late side effects in each of those. The one side effect that most people getting radiation treatment can expect is some degree of fatigue. I have seen side effects that range all the way from no side effects whatsoever. People are like, are you sure they're turning the machine on? It makes noise, but I don't feel anything and nothing's happening. To, I have to put this patient in the hospital because they're having such significant side effects that we need that level of care to take care of them and get them through the treatment. And another thing to know is that this is not your grandma's radiation therapy. The way we plan radiation therapy now is completely different than the radiation that your grandma or even your mother had. So the side effects that they had are probably going to be much more severe than the side effects that you can expect to have. Also, just because somebody else has the same cancer as you, don't necessarily listen to them. I have this a lot where people are like, well, my cousin had breast cancer and this is what's happening to her. What happens is that we look at the whole person. We look at how old you are. We look at what other diseases you have. We look at what other surgeries you've had. And we look at your tumor and we look at how weird it looks under the microscope and whether it's got this thing on the surface or that thing on the surface, and we come up with a customized treatment plan that is just for you. Everybody's individual, and so everybody gets an individualized treatment. So that's just another kind of thing to be aware of when you're talking to other people, even if they've got the exact same stage of the exact same cancer and on paper it sounds like the exact same thing, you guys might be getting appropriately different treatment recommendations. For certain cancers, we will be giving chemotherapy at the same time as the radiation. This is really common with head and neck cancers, cancers in the gut. If that's the case, then bear in mind that the side effects of radiation are oftentimes a little bit stronger when you're getting chemotherapy at the same time. The side effects don't change based on the fact that you're getting chemo, but they do tend to be kind of accentuated by the fact that you're getting two treatments together at the same time. So also, again, bear in mind, you may have some of these side effects, you may have none of them. So I'm just giving you the lawyer spiel of everything that could potentially happen, like at the end of the commercial where there's, that's what we're talking about here. So don't grab onto all this stuff and think this is all gonna happen to me. Just use it as a conversation starting point with your doctor of what would you expect me to have based on the treatments you're recommending for me. So as a brief primer, the way radiation works is it's basically, you can think of it like as I think of it as magic. It's actually not, it's like lots of complicated physics and radiobiology, but the more complicated something is, the more like magic it is basically. So I just think of it as magic. You think of it as magic invisible light that's being pointed at some part of you that's got a tumor that's not supposed to be there, and it's gonna kind of like, we as radiation oncologists hate the word burn, but we basically are burning this tumor that's inside you, right? And so we're focusing all these beams of invisible light on the tumor that's inside you, or where the tumor was if you've had surgery or chemo that's shrunk the tumor to where we can't see it anymore. So I'm gonna start at the top of the body and just work my way down. The side effects of radiation are going to depend entirely on the part of the body that we're radiating. So if I'm radiating your leg, you are not gonna lose the hair on your head. If I'm radiating your head, you're not gonna have nausea and vomiting. The side effects are going to be from that region of the body where we're treating you. So if we're starting at the top and going from the head, inside your head, again, hopefully is your brain. If there's tumor in your brain that we're treating with radiation, there's two different ways that we do that. One is with a very focused type of radiation that has a million different letters that we use to describe it. You don't need to know any of these, what they stand for. Don't worry about it. It's not like better or worse, just it's what your doctor's gonna call it. But it's basically super focused radiation. So if you have little tiny spots, a couple little spots inside the brain, we're gonna use this very focused type of radiation that's just gonna treat those little spots. And they're gonna use letters to describe it. When we're doing that, there tend to be fewer side effects from the radiation. You may have a little bit of fatigue. You sometimes can lose little bits of hair in one spot or another, but usually you don't. It's very well tolerated. You only have to go in like 3 to 5 times most of the time. If there are many spots in the brain that have little tumors in them, or the tumors are too big for the very more focused type of radiation, then we use something that's called whole brain radiation therapy. And that's basically just a bath of radiation that's bathing the entire brain. So it's what it sounds like, whole brain radiation therapy. That tends to have a lot more side effects. We've kind of moved away from doing this. We try not to unless we absolutely have to. People tend to get a lot more fatigue, much more tired. You can also have some memory problems with this. So it's not like you're gonna forget your name or your dog's name or where you live or anything like that. But if you can like go to the grocery store and you need to get 5 things right now and you can just remember the 5 things, maybe you need to write a list. And then you will probably lose your hair if we're treating your whole brain, because that means we're usually treating your whole head. There is another type of brain radiation that's kind of like halfway in between the super focused and halfway in between the whole brain, and that is appropriately called partial brain. And the side effects for that are kind of like halfway in between the nothing and the whole brain side effects. So moving on to below the brain, which is the part that we refer to as the head and neck, even though technically your brain is inside your head, we don't think of your brain as part of your head when we're talking about radiation. So your head starts at your nose for radiation purposes, and it goes down to your collarbone. This is actually one of the parts of the body that's very sensitive to radiation, so the patients that are getting radiated to these areas tend to have more side effects. And that's because we have what's called mucosal surfaces going from the nose down to the throat. And mucosal surface sounds kind of gross because of the word mucus, and that's why we call it mucosal surface actually, because it does make mucus, and that's how you blow your nose, and when you get a cold, all the stuff that comes out, and how you swallow, by the way. But mucosal surfaces are super sensitive to radiation therapy. They have a lot of reaction in them when they get treated with radiation, so the side effects of that are discomfort, pain with swallowing, pain with coughing, sometimes pain with speaking, sometimes you lose your voice, and then you can get really thick secretions, so your saliva can get thicker and kind of dry. And one side effect that does not sound on paper like a really horrible side effect, but that people complain about and suffer from a lot, is dry mouth. So the sensation that your mouth is just always dry, even if you're drinking water and that sort of thing. You can also lose your sense of taste while you're getting your radiation treatment. That's usually temporary. Most of the time that comes back. And then the saliva thickness usually goes away also after the radiation treatment, but sometimes that dry mouth can stick around for a long time. It can sometimes be permanent, and it can be very bothersome. And then the jawbones can be affected by radiation too. So the bones after they've had radiation do not heal as well as bones that have never had radiation. So if you need one thing that we do for all head and neck cancer patients is they have to see the dentist before we will start them on radiation. And that's because if you need any major dental work done, you need a tooth pulled or anything like that, it's best to get that done before you have your radiation rather than after. And that's because those bones are not going to heal the same way after radiation, and we don't want to cause like a chronic wound in your mouth if you have to get a tooth pulled afterwards. There's something called osteoradionecrosis. It sounds scary because it is. It's a bad side effect. It's very uncommon, but it basically means that the radiation has damaged the blood supply to usually the jawbone, and the bone itself starts to decay. The only time that we ever really end up like overdosing that bone with radiation is if there's tumor in the bone, and if there's tumor in the bone is already damaged from the tumor, and it's better to have the risk of damage from radiation than the actual definite damage from the cancer. So the skin on the neck can get red, dark, sometimes blistering and peeling. Your doctor will give you creams to keep your skin in good shape. Another late side effect of radiation when we're treating the neck is the thyroid gland. So the thyroid gland sits right here. It's really super important in your metabolism, and it's also pretty sensitive to radiation therapy. So if that gets damaged by the radiation treatments, you sometimes would have to take thyroid hormone replacement pills. All right, so moving on down. Below the clavicle is the chest. Side effects from lung cancer radiation, things like fatigue is pretty common. And then sometimes you can get some cough, you can get shortness of breath. Every so often, some people will get like even a little bit of what we call blood-tinged sputum, which just means you cough up little teeny pieces of blood. And usually, honestly, that has more to do with the tumor breaking down, but sometimes it can be from inflammation from the radiation. A late side effect from lung radiation is something called radiation pneumonitis. Now, this is very rare, so it's not something that we generally expect you to have from your lung radiation, but it is very serious. It goes anywhere from something that we see on a scan that you didn't even know that you had to we have to put you in the hospital because it's affecting your breathing. You get a cough, you get a fever, you get shortness of breath, you feel like crap, but it's not an infection, so instead of antibiotics, we treat it with steroids. The other thing you can get when we're treating something inside your chest is a sore throat. If we're treating the lung, the esophagus, that swallowing tube that goes all the way from the top of your chest to the bottom, can get irritated from the radiation. Even though we're treating like down here somewhere, you're gonna feel it right here. So it's gonna feel just like the sore throat that you get when you have the flu, and you're gonna be like, doc, why do I hurt up here? If you're treating down here, you're pointing the radiation at the wrong spot. They're probably not. I mean, it's worth checking, I guess, to make sure they're treating the right spot. But it's also just this weird thing in your body that even though the pain, the damage, the inflammation is down here, your body just feels it up there. They'll give you pain medications, all sorts of mouthwashes and things to get you through your treatment as comfortably as possible, and also to make sure that you're maintaining your nutrition because that's important too. The ribs can get irritated from radiation also. Any bone that gets radiation can be affected by that radiation, and it may be more fragile in the future. So it doesn't mean that you're gonna just like cough and break a rib, but that rib may be more sensitive. There's a small percentage of patients that can end up with like some chronic chest wall pain that sort of is like persistent after radiation treatment, but most of the time it's something we just treat with like a Tylenol if needed. So most breast cancer patients are gonna get some form of radiation. So when we're treating the breast with radiation treatment, it's actually one of the better tolerated parts of the body, I would say, kind of because it's like hanging off. It's not like we have to worry that much about like the spinal cord or, you know, the guts, because it's like nice that mostly what we're treating is air, right? The side effects, as far as like early side effects that can happen during the course of radiation are things like the skin changes. So the skin can get darker. You get a tan in like this funky tan line. Like usually if you get a tan and it's in a weird shape, it's the light part that's the weird shape, right? Because it's the part of something that was laying on you and then you laid out in the sun and fell asleep. This will be the opposite because it's the dark part that'll be in the weird shape. You're gonna have like this square on your chest. So you can have darkening of the skin. Sometimes you can get redness or irritation. That's a little bit less common. Something that does happen to a lot of patients is this feeling right where the surgery was of like somebody poked me with a needle, like really quick pains that don't last for a long time, or like a little electric shock. And we call those healing pains. What it actually is it's the nerves that are regrowing where you had the surgery that are responding to the inflammation that's part of the healing process from the surgery and the inflammation from the radiation. So those can become more frequent during the course of the radiation treatments, but they go away after you're done. The breast can also become a little bit heavier. Sometimes it can be a little bit swollen. The breast itself can change a little bit, so it can become a little bit shrunken, a little bit firmer, a little bit more upright. Whatever cosmetic outcome you got from your surgery, the radiation will not improve it. Other things that can happen on that side are that the ribs, the bones right behind that breast, are gonna get some radiation, and they may be a little bit more fragile in the future. So it doesn't mean that you're going to like bump into a wall and break your rib, but if you have a bad fall or you are in a car accident and hit the steering wheel really hard, you might be more likely to crack a rib on that side than on the other side, and that is a permanent change. Also, you can have a little bit of scarring at the front of the lung. Usually it's not something that you would notice. It shouldn't affect your breathing. It shouldn't affect your ability to run around and do whatever fun things or not fun things you normally do on a daily basis. But I tell my patients about it for a couple reasons. One is because if you get scans in the future and they see that area of scarring, they may comment that there's scarring there or that there's markings at the front of the lung. It's really important you know that that is from radiation and not from cancer. And the other reason is because very rarely that region of radiated lung can get inflamed a few weeks after you finish your radiation treatment, and it causes what we call radiation pneumonitis, which just means inflammation in the lung. You get a cough, you get shortness of breath, fever, chills, you feel like crap, but it's a very rare side effect with breast radiation nowadays. So I don't know if it honestly even still happens from breast radiation. I'm sure it must still happen because it's still like in the textbooks and stuff, but I've never seen it. So not something to be super worried about as far as your breast radiation goes. So when we're treating the left breast, we also do have to take special care to avoid giving too much radiation to the heart. There's sort of like no exactly safe dose of radiation. So like any radiation comes with some risk, right? You're not gonna like have a heart attack because you had radiation for left-sided breast cancer. The way we think about it is sort of like if your cholesterol went up 20 or 30 points, like that's bad, right? It's not good. You want your cholesterol to be within a normal range. And if it goes up, that's an indicator that you're at a higher risk for having heart disease. But in and of itself, like a high cholesterol number is just a number on a page. It's probably going to increase your risk of heart disease in the future slightly. Doesn't mean that you're going to have heart disease, right? It just means that your risk of developing heart disease may be higher than somebody that didn't have the radiation there. So moving down from the chest cavity, below your chest is your abdomen. Again, the type of side effects you can experience are dependent on the part that we're treating. So in the belly, the side effects is usually nausea. Nausea, sometimes vomiting, sometimes loose bowel movements. Anything outside of that, you're probably not gonna feel. You can ask your doctor if you can maybe pre-medicate with an anti-nausea medicine before you get your radiation treatments each day, and that can prevent a lot of that. It's really important to get your nausea as well under control as possible because you need to keep eating even though you're not going to want to. And then you don't want to get dehydrated. And if you have a combination of nausea, vomiting, and diarrhea, loose bowel movements, you're definitely going to get dehydrated. You have to like be super duper on top of hydration if that's the case for you. And then you can sometimes get belly pain too, like cramping type, just like when you have the stomach flu type belly pain. And your doctors should be able to give you medications to kind of help out with all of that. Part of the reason it takes us so long to plan radiation is because we don't want to overdose anything, but especially the normal organs that don't have cancer in them, right? Like we don't want to cause damage to the stuff that's healthy and fine. So that's things like kidney, liver, spinal cord, super important. We definitely don't want to overdose that. But there is always a small risk that those organs could be affected by the radiation. Again, it's not usually something that you feel. It's not like it causes nausea or it causes vomiting. It's the sort of thing that your doctor is going to kind of be worrying about in the background and taking care of for you if they notice any lab abnormalities or anything like that. Below the abdomen is the pelvis. So inside the pelvis, you've got the lower part of your colon, like your lower part of your digestive tract. So there's some bowel down there, there's the bladder. If you're a woman, your internal genitalia. So the side effects for getting pelvic radiation are gonna be related to all those structures. So the rectum, if the rectum's getting some radiation, you're gonna have increased frequency of bowel movements, loose bowel movements, maybe some diarrhea. If we're treating very close to the anus, those muscles can get inflamed and you can actually have some even some leakage of bowel contents. That's uncommon, but it can happen, and usually it's reversible if it does happen. So, not fun. But more commonly, increased frequency of bowel movements, increased urgency. So maybe you're not getting the warning that you used to get. Increased frequency of urination. Sometimes a little bit of burning when you pee is not uncommon also. These are all things that you need to talk to your doctor about if you develop these side effects, because they have medications and different things that they can do to help you out. If you're getting radiation to like your uterus or your cervix, the vagina is going to end up getting some radiation. You can have what's called vaginal fibrosis, which basically means the vagina is not going to be as stretchy as it was before, and something called adhesions, which is that the front and back walls of the vagina can kind of get stuck together in different places, which is really not fun. So you can talk to your doctor after treatment. They should talk to you about something called a vaginal dilator, which is basically a super expensive prescription dildo. And you just put it in there and leave it still in there. It's just to break up any little bits that could be healing together. If you are still of childbearing age or thinking that you may want to, have more children in the future, before you undergo pelvic radiation therapy, you definitely need to talk to your doctor about that. You might want to consider egg harvesting, which takes a little time. The eggs in the ovaries and the pelvis can definitely be affected by radiation. There's the potential that it could put you even into premature menopause. but also it can damage the eggs. So if you're of childbearing age and you think you might want to still have children, you should definitely talk to your doctor about fertility maintenance. Especially when we're giving radiation to the prostate, we do a relatively high dose and it's right next to all the erectile tissue for the penis. So the stuff that makes the penis hard is partly inside the penis and partly inside the body. And so you can have a risk of erectile dysfunction following radiation therapy. The risk of that varies a lot, depends a lot on your health going into radiation, your erectile function going into radiation, whether you have heart disease, diabetes, high blood pressure, that kind of stuff. Another thing when we're treating the prostate is that the prostate is the gland that makes the majority of the ejaculatory fluid. So it's not uncommon after radiation therapy for prostate cancer for men to have a significantly decreased volume of their ejaculate. Usually they can still have orgasms without significant problems, but it's just like you can't make a mess anymore. So the pelvic bones can be affected by radiation therapy as well. Actually, you make a lot of your blood there. So if there's a lot of the pelvic bones end up getting radiation, we do have to sometimes check on your blood counts and make sure you're not getting anemic or low white blood cell counts, which could affect your immune function. And then those bones, and particularly your hip bones, could be at slightly higher risk for fracture in the future, depending on how much radiation you get. One thing that I mention to most of my patients, especially if they're under the age of honestly about 55, one of the most rare side effects, but the most serious side effects from radiation therapy, which is a late complication, is that anytime we give any radiation anywhere in the body, there is a very tiny chance that that radiation we're giving you can contribute to the formation of a different cancer in that spot. Now, if the radiation causes cancer, why would we be giving radiation as treatment for cancer? Because the radiation is much, much better at killing cancer than it is at causing cancer. So the chance of your own cancer growing back because you don't get the radiation is way higher than the chance of us causing a cancer with the radiation that we're giving you. And the chance is like super duper duper low, but super duper low is not zero, right? So this is not something for you to like freak out and be super worried about, but it is something for you to be aware of, and maybe you can bring that up in discussion with your doctor to see how concerned they are about it. The risk of having a cancer that's caused from the radiation is higher the younger you are. So this is something that we don't worry as much about in patients that are over the age of like 65, 70, but much, much more risk in patients that are like under the age of 40. So if you are like around 40 or younger, it's definitely something that you want to talk to your doctor about. It's not really the best reason to not get the radiation again, because if your doctors are recommending radiation therapy for you, there's probably a really good reason. And that reason is that that radiation is most likely to make you live longer, that the risk of the radiation causing a cancer is going to be super duper low comparatively. Right, so that's a lot of information. It can be a little overwhelming. The great thing about YouTube videos that you can do here that you can't do with your doctor in real life is that you can pause and take notes. You can rewind and watch it again. So if there's something that you missed, go back, watch it over, get all the information that you need, and then really use this as a springboard for conversation with your oncologist. If you thought that was helpful, go ahead and hit subscribe or watch some of my other videos, and I'll see you next time.